Okay, I'm at Dr. Kulich's office with his two myofunctional therapists. And your names?
Jesse and Victoria.
And we are going to talk about what myofunctional therapists actually do with patients. So that's kind of what I want to dive into today. So how does what you guys do integrate with Dr. Kulich's overall practice?
So we help with the function aspect of treatment. A lot of soft tissue dysfunction, malocclusion, or collapsed jaw is a result of myofunctional therapy dysfunction. So if your tongue is not able to function correctly, which it needs to be on the palate, then a lot of times the jaw will collapse and your jaw will not develop correctly as it should. So with myofunctional therapy, we help retrain the tongue to be able to sit comfortably on top of the roof of the mouth so that the jaw can then grow correctly.
Totally.
I'll say too, we work as an adjunct. I mean, there's not one without the other. Dr. K will not treat certain people or certain situations without myofunctional therapy.
Why?
Because there's a lot of research that shows that relapse is at a much higher rate. So, you align the teeth. If you don't have soft tissue strength or tonality or proper functions, that the relapse is just really great. And so it's not worth it to go through all that for the money, for the time, and then have it all relapse. There's also, any frenectomies, to do those without myofunctional therapy, the chances of reattachment or regrowth or scar tissue building is much higher. And so again, to do those procedures without myofunctional therapy, there's no point.
Totally. So yesterday I actually was interviewing an oral surgeon. His name is Casey Lee, and he told me that he had just taken in a patient yesterday who his jaw surgery had relapsed, and he believed that the jaw surgery relapsed because the patient after the surgery continued to mouth breathe. So this is kind of like your point that you need good habits to stabilize expansion results. You can't just create this form and then expect it to remain solid, because the body is kind of like the earth. It's in motion all the time. It's like a living thing. It's not a piece of concrete.
Exactly. That's exactly right. If that continuous force or lack of force is not there, it's not going to hold the structures where they were placed.
Right. Yeah, and I would say that's probably a super underrated thing on my channel. People want to get bigger, whether they want to become better looking or whether they want to breathe better. They just want the box to get bigger, but they don't think about maintaining the box over the long term, which is where a myofunctional therapist comes in. So if you had to say maybe 3 or 4, what are the 3 or 4 key habits for a person to have good myofunctional, let's say, skill?
So Jesse, I'll let you do that, but the 4 pillars of myofunctional therapy.
Right, so our 4 pillars are correct lip seal, nasal breathing, tongue posture, and correct swallow. So those are what we are always trying to address. You have to think of the tongue as being the retainer of the mouth. So if the retainer isn't up on the palate where it should be, it can't hold the teeth out correctly. It can't keep the jaw what we're looking for, wide arch.
Right.
And also the palate is the base of the nose. So if that's not wide, you're not able to use your nose correctly for optimal nasal breathing as opposed to mouth breathing.
Have you guys ever heard of mewing?
Yes.
So what do you think is the relationship between myofunctional therapy and mewing? Sort of a trick question, by the way.
I don't know enough.
I think it's the same exact thing, because you have millions of views on YouTube where people are talking about breathing through your nose and having good tongue posture, pressing the tongue up onto the roof of the mouth and sealing their lips, and they're calling it mewing. And those same people are like, what the hell is myofunctional therapy? I'm like, guys, it's the same thing.
I think it's the same. I think myofunctional therapy is addressing the full range of dysfunction, where mewing is focused on one aspect.
Which would be?
Tongue posture.
Tongue posture, okay, right. So not for me. In my ebook that I'm publishing in weekly posts over the course of a long period, my definition of mewing is all proper oral facial habits. So I think that there's room to have a more expansive definition of mewing, and then when you do that, it really starts to gel with myofunctional therapy, and they sort of become one and the same. What age do you guys mostly work with in terms of patients?
I prefer 4 to 5 and up. Ideally, just because I think they're easier in the therapy aspect of it. That being said, I think so much of what we do is based on parent compliance as well, especially at those smaller ages. You need to have a driver of the treatment, and a lot of times when they're 4 or 5 or 6, they're not going to want to do the exercises alone, so it really depends on the parents making the choice and the commitment to the therapy.
I'll add to that and just say that children under the age of 4 and 5, there's a lot of just knowledge we can give to parents and small smaller little things. Like if you notice that there's open mouth posture, these are things that you can do, like getting rid of sippy cups and pacifiers and little techniques to kind of close their mouth at night to just help that muscle memory, as well as like humming in the car or doing little clicking your tongue with your 2-year-old that can really make an effect as they get older. So although we wouldn't do therapy necessarily with them, there's a lot of just knowledge and little tips and tricks that we can give to parents and children that are under 4 and 5. Once they're 4, 5, I mean, that's the starting, and it depends on the child and the parent about how much they'll actually do. 6 and 7, they can really do all the exercises, and then, I mean, goes right up to 110, you know? You can make differences in people that are much older as well.
By just getting them to keep their tongue up more throughout the day, which helps them keep it up during sleep, for example, and that might help with their sleep disordered breathing.
Exactly, just helping the strength of the tongue and that muscle memory to have the tongue be able to stay where it needs to stay.
Yeah, I actually like working with the older patient population myself because I feel that if they are here, they're super driven. They understand what the benefits of the therapy are, so they really take it seriously, and then they see the change in themselves, and it's amazing. I mean, a lot of my best patients were in their 60s, and they're awesome, and they're so happy that they did it. They were committed to the treatment the entire time, and just to improve their life. I mean, even 50% better, that's 50% better breathing every night.
Even without any kind of expansion or anything like that, just therapy alone?
Just therapy. I mean, a lot of times just releasing a tongue and, you know, teaching them how to hold it on their palate correctly so that it's not slipping down into the throat at night. You know, it's keeping the airway open throughout the night. And that's less grinding, less snoring, less bathroom trips, less movement, waking up, all of that.
So what does it look like when you work with an adult patient? Most of my audience are adults, so do you meet with them once a week, once every other week? What is a session like?
So we usually do in the beginning every 2 weeks. Towards the end of treatment, we'll start to do maybe monthly. We can do it in person or on Zoom, and it's typically just a series of exercises. So we'll give like 3 to 4 exercises each session. We'll ask them to practice them twice a day and then come back. If the exercises are done proficiently, then we move on to a new set of exercises. And it all kind of builds on each other so that week by week they're increasing their tongue strength and their tonality and their lip strength, and we just work them through treatment.
What would be maybe 1 or 2 exercises that you could recommend for the people watching at home that they could try and just to get them on the way to developing better habits?
I mean, I think there's so many good, easy ones. You know, when we're in treatment, really, we want you sitting in a chair, proper posture, in front of a mirror. That's the best way to do the therapy. But anytime you're driving in the car, sitting in a waiting room, things like the tongue clicks that I had mentioned before for children, I mean, just doing those simple clicks, and then what we call suction and hold, I think.
So how does that go?
So the clicks are just...
I like
We're
that.
gonna write a song.
You're trying to isolate the muscle, just like you would if you're doing a bicep curl. You're trying to just use your bicep. You know, you're not swinging the weight up and down. So you want to keep the jaw as stable as possible. But again, if you're just doing some clicks, it's better than nothing. And then building on that, before you make a click, you have to suction your tongue to the palate this way. Yeah. And so that's a suction and hold. And you would just sit there like that, as much of your tongue up into the palate as possible, and just holding it there. That's a really good one. And this is, you know, proper tongue placement. Basically, this is where you want to be all day long. This creates an open airway, creates that retainer that Jesse was talking about before, where if you have a developing arch, if you're a child under the age of, say, 12, and your tongue is up in that place, it's going to help guide your teeth into that proper arch. Right. And then as an adult, I mean, you're not going to necessarily move much. You might move slightly, but if you've just had ortho, it's going to help retain those teeth the way they are and build a lot of strength with your tongue in the proper place that it needs to be. So I think lip pops and pufferfish are good for cheeks and lips, and lip pops is this way. And
what permanent sort of form are you trying to achieve with that, with regards to lips?
That's more like lip seal. Just, again, strength to keep your lips together, and that muscle memory of this is where your lips are supposed to be. I guess it's more the strength than the latter.
Most of our patients have an open mouth posture because this is the way that they have developed over years and years. So most of them don't realize that they have an open mouth posture, but they do. And any parting of the lip lips is an open mouth posture. So the lip pops are good exercises to help them regain the strength that they lack.
And also to just get them to be more in touch with their lips.
Yeah, just to create the neuromuscular connection that your lips need to be sealed in order to use your nose correctly.
Right.
And it all goes back to breathing. You know, breathing is such a large aspect of it. And what we see a lot of our patients are chronic overbreathers because they use their mouth rather than their nose to breathe on a daily basis and all through the night. So just trying to get their body to understand what it should be doing is our goal.
I think the concept of overbreathing is counterintuitive because people think that when they have messed up facial structure and form and function that they're not getting enough air, but this weird thing happens that when you mouth breathe, you, like you said, overbreathe. So what do you mean by that?
So your mouth is usually open when you're breathing, or you're, you know, sighing a lot, or yawning is also a sign of overbreathing. Your body becomes accustomed to a certain amount of oxygen. And when you don't have that, even a little bit less, your body wants to compensate. So it will tell you that you need to take a big breath or sigh, or even chronic over talking can lead to all these things. But your body doesn't actually need as much oxygen as you might think that it does.
It has to do a bit too with just the exchange of carbon dioxide and oxygen. And when you're chronically over breathing, you're taking in too much carbon dioxide, so then you need more oxygen. So if you slow that down, then you take in less. I think I'm getting this right. It has to do with that exchange.
The O2-CO2 ratio.
Yes, because you have to have the CO2 in order to trigger your brain to tell you that you need oxygen. If you don't have carbon dioxide, then your body doesn't know to take in more oxygen.
Right, so the overbreathing, it has something to do with like expelling too much carbon dioxide, and that kind of throws off the ratios and messes you up. And do you guys teach Buteyko breathing? Is that something you guys do here?
Yeah, we're definitely
That's
big fans
something
of
that always,
Buteyko.
I could never understand Buteyko breathing. I just know that it has to do with slowing breathing down, having less air in, less air out, something along those lines.
Yeah, more air out, less air in. So I try to do like a 4-6 breathing, a count of 4 in and a count of 6 out. And if you can maintain that really slow breath, that's more ideal for what you need.
What happens for someone who doesn't do myofunctional therapy along with a tongue tie release? What are the dangers that are associated with that?
This like breaks our heart.
Yeah, it does
When
break
people
our
do
heart.
not do myofunction, or there's a dentist that is not insisting that a patient have myofunctional therapy along with a frenectomy, it makes us cringe. We're just like, this is just not right because of so many things.
Have you seen some bad things happen with that? Like tongues healing shorter?
Yeah, I mean, the scar tissue can build up and then it can become tight and tighter. It just seems so unnecessary to go through that process and just not do a couple of extra steps to get the best result. I mean, the whole point of the myofunctional therapy before the release is to just start elongating the tongue and moving the fascia and the muscle in a way that you're not used to. We help train you exactly what to do afterwards, like as far as the exercises and the stretches afterwards, so that you're really comfortable getting in there and doing it yourself afterwards. You know, you're not timid to put your fingers in your mouth or lift the back of your tongue up. But, you know, the whole goal is to stretch and elongate as much as possible. So if somebody just releases your tongue and sends you home without any exercises or preparation, you're not really setting yourself up for the best situation.
Right.
You want movement. It's all about movement.
For sure. One sort of controversial thing is people wonder if they have a small mouth and they try to do myofunctional exercises. It's really hard, obviously, when your mouth is tiny and you can't fit your tongue up on the roof of your mouth. If you expand, does it become way easier to do myofunctional exercises? Like, people think it'll just happen all by itself if you expand. What's your experience? Like, do you still need to train into the new space after you expand, or does it just happen on its own after you expand?
Well, I think you should think about your tongue as being like an octopus. Your tongue can move in many different ways. You know, there's 8 muscles in your tongue. 4 are for movement and 4 are for structure. So what we do is we teach your tongue how to use all of those muscles together. Like, one of our exercises is simply like to make your tongue skinny and put it up on the palate. You know, so instead of having like a wide tongue, which isn't really common, we teach you to skinny it. So we just changed the shape of the tongue to fit it into your palate, to accommodate for what you have. So I mean, even if you don't want to go through expansion, I think myofunctional therapy will help you because we're training your tongue to work for you in the structure that you have.
Interesting.
So, and I mean, I think definitely if you're expanded, it's likely that it will feel like a whole new space. And that's where myofunctional therapy will help too. Like, yes, things are going to be pretty instantly easier, but it's also a whole new space where you do need to relearn how and where to place your tongue and how to move it. It's the same with the frenectomies sometimes. Like, people have, of course, very different experiences, but there's a lot of times where people will have a lingual frenectomy and now can move their tongue in many different directions, or range of motion is just exponentially different.
Actually, Dr. K released my tongue 4 years ago, and that's how I got into this, is because I kind of did like a self-guided myofunctional therapy. And afterwards, I always describe my tongue as being like a flag in the wind. Like, even when I would speak like 3-syllable words, it'd be like, I had like this weird flapping thing going on, and I had to teach it what to do again, you know?
Yeah, you have to rein it in.
I literally had to rein it in. It just felt very new and different.
One thing I really like about myofunctional therapy as compared to mewing is the emphasis on suction. So my most viewed video ever, I think it's combined views like 30 million or something, is just, it's like a 60-second video where I'm just like, how to mew. And then I'm like, put your tongue up on the roof of your mouth, seal your lips, suction, suction, suction. And that's what made the video different than the billion other mewing videos on YouTube, was I was telling people to just suction their tongue on the roof of their mouth instead of pressing it on the roof of their mouth. And so in myofunctional therapy, you always learn to suction, right? Can you talk about the importance of suctioning as opposed to just pressing the tongue? It might seem basic to you, but like, this is a really sort of unheard of lesson in the mewing community.
Well, I think it is basic. I mean, it's a natural suction cup effect that our tongues are able to do. When we are born, our tongues should be able to suction cup onto the palate naturally.
Like as part of breastfeeding? How do you mean?
Yeah, I think
It's just the natural
it's just
place for the tongue
natural.
to be. If you take an infant's chin and gently pull it down, their tongue will be suctioned to the roof of their
A
mouth.
baby?
Yeah,
I've seen videos of that.
It's pretty amazing.
It is gnarly, yeah.
It's the best way to check.
So it's just a normal thing. And yes, maybe that is part of how they breastfeed, or that movement of the tongue, how it works, but that's where the tongue is supposed to go. And so it's just there.
I think that the big part of what the mewing might miss and what we do is we're very focused on the posterior portion of the tongue being suctioned onto the palate, which I believe if the back of your tongue is suctioned up, that is sealing off your airway. You cannot breathe through your mouth. It forces you to breathe through your nose.
Right.
Which I think is like the key to all of this. If you can get the back of your tongue up, then you can get the middle of your tongue and the tip of your tongue up on the palate. You have to breathe through your nose. Then you can close your lips. Then you're in perfect function.
And you're saying even people that have imperfect jaws that might be small and could obviously benefit from some expansion, because the tongue is so multifaceted, it has 8 muscles, as you said, and you can reshape it by training it. So you can actually teach people with smaller jaws to use the limited space they have more efficiently. Is that right?
Yeah, I mean, I think as long as they're not restricted by a tie and they can put their tongue onto the roof of their mouth, then we can train it to stay there.
Yeah.
Most people don't even realize that their tongue should be on the roof of their mouth.
I know, it's bizarre, isn't it?
It's wild.
Yeah.
Yeah.
I don't think a lot of people know that they're breathing through their mouth all day long.
Right, yeah.
You know, it's when you start to say in our initial evaluations, one of the questions is, do you breathe through your mouth? And most people say, no, I breathe through my nose all day long. Maybe at night, sometimes I'll snore, sometimes I breathe through my mouth. And then when they come back, they're like, I breathe through my mouth.
Wow.
You know, all day long. I catch myself, I'll walk up the stairs and I'm breathing through my mouth. I'm cooking dinner and I notice, you know, it brings a big awareness to it. And I think it's just so normal that you don't realize that you're doing it.
How do you guys feel about gum chewing?
I love it.
It's great, isn't it?
Gum
I'm
chewing.
not a gum chewer.
You're not.
No.
What's your
I mean-
fixation? Do you hard candies or anything? Or do you just
No.
just tongue posture?
Just perfect tongue posture at all times.
Okay, I'll tell you, the gum chewing I think is great. I think for young kids, even though my parents would cringe, we were never allowed to chew gum.
Oof.
I mean, go with the sugar-free for sure, but it really, in children that are mouth breathing, it builds the orofacial muscles. It helps stimulate the bones in the jaws because you're doing those movements. And so I'm all for gum chewing for children, adults, because I think it helps for people that need it. I mean, if you don't need to chew gum because you don't have any dysfunction, then fine. But I think it's a really good tool that's easy. That
And fun.
And fun.
Yeah, and tasty.
And minty and fresh.
I'm thinking about it differently now.
Good for
now
the breath.
I'm thinking about it differently.
Well, I mean, that's why I put it in the baskets, because it's a good
yes.
myofunctional therapy tool.
What brand do you put in the baskets?
I put Pure. pure. It's like, you
Xylitol
know,
gum.
Yep, it's a xylitol
The
gum.
little tabs.
Yeah, it's like PUR. I'm not even sure.
Yeah,
if
with the
pure.
2 dots over the U.
Yes.
Yeah, it's
exactly.
good stuff.
That one, and
I love
then
that
there's
stuff.
one other one that I like too, and I can't remember the name of it right now. But yes, like sugar-free. The more natural, the better. And I think it's a great myofunctional therapy tool.
Me too. Can we do one more?
Yeah.
Okay, I heard another myofunctional therapist say once that all of myofunctional therapy is just trying to teach us what we didn't learn because we weren't breastfed or breastfed enough. What's your reaction to that? It's a very controversial
I
statement.
don't like that statement.
Yeah, we don't like that statement.
We love breastfeeding.
We love breastfeeding, but I also bottle fed my children. So we want to like get rid of the stigma of the whole thing.
The whole like you must breastfeed or else your baby's gonna die thing.
Yes, there should be no shame in however you feed your child. That's fine. We can always fix things. Just because you started out one way does not mean you can't change.
Also, I have a patient who was breastfed, you know, until she was
8?
2.
No, I'm just joking.
Literally, until she was 2 exclusively, and then until she was 5, whenever.
On and off? Wow.
Yes. She has so much malocclusion, misalignment, open mouth posture the entire session. She's sitting here, her mouth is just gaping open. So although I think, yes, I believe it's the best thing for health reasons and for the development of jaws and tongue and strength and all of that, it's not the only thing.
Right.
It's certainly not.
It's not.
And I see a whole range of bottle-fed, breastfed, combination of both, and there's definitely dysfunction and malalignment and occlusion in all of them.
Super interesting. Yeah, it's a very nuanced issue. I think that like people want elegant explanations for things. Oh, I wasn't breastfed and that's why I'm the way I am. And oh, if we just breastfeed, it's the solution to all the world's problems. But there's obviously a complex interplay between genes and environment, and it's not all one or the other.
100%.
Absolutely.
100%.
Yeah. And it's never too late to intervene and get someone on the right track.
Never.
Even as 60-year-old.
60, 80.
Yeah, right. So we can all take hope in that.
Yes, absolutely.
Absolutely.
All right, well, we've got to get to this baby's lip tie
right.
release with Dr. Kulic. So thank you guys for your time, and I appreciate your insights, and we'll see you on YouTube.
Okay,
All right,
thank you
awesome.
so
Thank
much.
you so much.
Okay, thank you.
Bye-bye.
All right, bye.